thanks very much for coming. And if you weren't here 2 weeks ago, don't worry. It's not like a continuation of our last seminar. It's I guess an alternative topic, and I will revisit some of the things we talked about last time within the context of digestive health. So if you weren't at the last seminar, you can still get some of the ideas or the principles of eating, which is what I like people that come to my seminars to leave with, is some fundamental ideas of what they should eat. I'm a nutritionist, and so it is quite kind of easy for me to sort of go beyond like what's on the plate and get into details on probiotics and prebiotics and supplements and testing and things like that. But first and foremostly, my clients and the people that are listening to me should always have an understanding of what they're eating, and ideally when they should be eating it. That's like number one, numero uno. Anyway, today's discussion is a bit of an extension of that, because we are going to go into prebiotics and probiotics. But before we get there, I want to talk about what is digestive health, what are some of the signs of less than optimal digestive health, and why do we want optimal digestive health? And then we can start getting into action mode and talking about like some of those razor edge habits that you might want to build into your day, your week, or your lifestyle. I should say that there's plenty of reading to do on digestive health over at our website, which is thenaturalnutritionist.com.au. So if there's anything that piques your interest in this chat, you might find more details on it at our website. And you can also, reach out to me directly if, there's something that you want more details on. But digestive health, or gut health as some people may call it, I prefer it digestive health because our gut is just much more than our large intestine or our small intestine. So I use the term digestive health. It's a vogue topic, right? Like a lot of people are talking about it. People are starting to hear that quote from Hippocrates, which is all disease begins in the gut. And that's, I don't know if any of you have heard of that before, but it's certainly becoming a more commonly heard phrase. And from my perspective, if all disease begins in the gut, then so too does all good health. So I spend a lot of time talking about digestive health with my clients because really it's the center of it. Like it's physically the center of it, but it then does have a huge flow and effect to our overall health for a number of reasons. So it's this vogue topic, but not a lot of people can actually articulate what digestive health is. I'm sure if I asked you each, you'd be pretty intimidated to get on the spot and tell me or articulate what digestive health is. And I think that highlights that we sort of throw around this term gut health, but what actually is it? So I like to explain a optimal digestive system as being one that can do three things. So the first of those is to provide a barrier of defense between us and the outside world. So our digestive system, think of the inside of it as being like the outside world, and the other side of that being us, the inside of us, our blood, our lymph. And so that the actual gut wall, the lining, that is the barrier of defense. It's the line of defense between whatever comes in and whatever makes its way into our tissue. So number one, it's a barrier of defense. Number two, it's got to support efficient digestion of the food that we consume. So it's got to support the breakdown of what we eat, so we have access to nutrients, so it can then perform its third job, which is to maximize the absorption of the nutrients within the food we consume. So they're the three main roles of the gut and the digestive system. But what I'm finding is that things are going wrong in either one of those places or a number of those places. And it's what's leading to the signs and symptoms of less than ideal digestive health. So some of the signs of less than ideal digestive health, and I'm going to go through this long list because not everybody puts these together. Not everybody links these signs and symptoms with their digestive system and capacity. Some of them are obvious. So top of the list is bloating. So if there's bloating present, either straight after a meal or towards the end of the day, then it's suggestive of less than ideal digestion. So the food's not being broken down adequately. It's being passed on to, or it's either drawing water into the small intestine, or it's being passed on to the large intestine, partially undigested, where it's left to ferment, create gas, and therefore distension. In some people with conditions like irritable bowel syndrome, they've got what's called visceral hypersensitivity. So that bloating, that distension actually creates a lot of discomfort. So I've been there. I'm like a long-term IBS sufferer, which is probably why I focus a lot on digestive health in clinic. But that feeling of almost having like a balloon expanding from behind the belly button, that is like, if you haven't got it, that is what people with IBS might feel when they're bloating. Another common sign and symptom of less than ideal digestive health is inconsistent bowel motions, right? So you can have inconsistency whereby somebody might have constipation. And you have to expect that we were going to talk about poo in this session. So inconsistencies, that number one, there might be constipation. And a lot of people ask me, like, how do I know if I'm constipated, or what even is like classified as constipation? If you're not going to the toilet every day, then there is a level of constipation there, and there is some work that could be done to get your bowels moving more regularly. That regular bowel motion is actually really important. So it's not just about that feeling of feeling empty and moving things on, but your bowel motion is like elimination for toxins and excess hormones. And so if you've got that stool sitting there for longer than it should, or longer than it needs to be, then there's an opportunity for those toxins to be reabsorbed, those hormones to be reabsorbed, and it can start to impact on toxin load and hormone imbalance as well. So things like estrogen dominance. So you want to get those bowels moving regularly, not just so you feel good, but for those other reasons that I just mentioned. The other side of that is diarrhea, or excessively loose bowel motions, or needing to go excessively over the course of the day. And excessively, I would say, is anywhere above anywhere above 3 bowel motions, or anywhere that's in stark contrast to what you're used to. So if you've previously been used to going 1 time a day, and then suddenly you're going 4 times a day without any like intervention in the meantime, then it's a sign that something's going on. For some people, they flip between the two. So they'll flip between constipation and diarrhea, and that is not ideal either. It is often a sign of a condition called small intestinal bacterial overgrowth, or we say SIBO. That inconsistency, that flipping is highly correlated with conditions of SIBO, for anyone that resonates with that. Indigestion is another common sign and symptom. So we sort of associate indigestion with older people, you know, and those common signs and symptoms of indigestion I'm referring to here. So that burning sensation in the middle of the chest or in the throat. And there's some less commonly acknowledged signs of indigestion, which is nausea, or when it's really bad, waves of pain, or mucus building in the throat. So indigestion is actually not just a condition of the older people. Certainly they're more susceptible to it, because as we age, our stomach acid levels actually decline, which means we don't digest food as well. And that can be a precursor to indigestion. But other people are also at risk of decreased stomach acid, or changes in pressure in the stomach, which is what can lead to indigestion or reflux. Some of you may have heard it being referred to as. Reflux is actually not a condition of having like excess stomach acid. So our stomach, as I'll get into, is a very acidic part of the body. So it's not excess stomach acid, it's the incorrect placement of stomach acid, which leads to the signs of indigestion and reflux. And there'll be a cause for that, which we want to get to the bottom of. Food intolerance is another common sign of poor digestive health. So somebody that has a long-standing food intolerance, like lactose intolerance, or somebody that has a new sort of forming intolerance, whether it be to things like FODMAPs. Some people also just have no idea what that intolerance is due to. So they might find that they can eat, you know, milk one day, but then the next day they can't tolerate it. And so that's where we need to do a little bit of digging to have a look at like what adequate serving size is. And also to see if it's actually not the food that's that's causing the response, but whether there's something more deeply sitting there. So I don't know if any of you have heard of this term called leaky gut, but that can be a precursor to food intolerance as well. And that's when you get that seemingly like irrational spread of foods that you're reacting to. That would most likely be a symptom of increased intestinal permeability or leaky gut. Poor recovery from exercise. Now, this one can surprise a lot of my athletes, and maybe something for you guys to think about. But as you might be aware, when you exercise, there is a level of exercise-induced inflammation, which is not necessarily a bad thing. It's like part of the training process, and then your body deals with that. But if there's inflammation coming from elsewhere, like from the gut, then it can be like the straw that broke the camel's back, and it can leave you susceptible to poor training recovery or niggling injuries. So you want to potentially look at the gut in those cases. Unexplained skin conditions. So for those people with eczema, psoriasis is a big one. I have a friend who sort of, whenever she eats gluten, she gets a little patch on her forearm. That's like her sign that she's eaten gluten. And that's like knowledge that she's built up over like a 10-year exclusion phase. But our skin is our largest organ. And so often if something's wrong at the center of us, then it may manifest in what is our largest organ. So unexplained skin conditions, look to your digestive health. Poor memory and brain fog. So yes, there may be a level of poor memory and brain fog, like, I don't know, when you haven't had a good night's sleep or when you're stressed. But if it's chronic and seemingly unexplained, then it could be due to your gut. For one of the similar reasons that low mood and mood conditions can now be associated with digestive or poor digestive health. And that's because we have bacteria that live in our gut microbiome, so our large intestine, and they can secrete toxins, and those toxins can cross the blood-brain barrier and start to actually impact cognitive function and also neurotransmitter production. So hence they can start to impact our mood. Low energy, poor nutrient status, nutrient deficiency, and obviously nutrient deficiency would lead to or feed into low energy levels. So we've got certain nutrients which are real markers of digestive health. So things like iron studies, zinc levels, B12 levels, vitamin D levels. These are signs, like low levels there are signs of less than ideal digestive health. You know, you've all heard that saying, you are what you eat. We used to say that. We now say you are what you digest and absorb. So if you've got low nutrient status, then look to the gut. And poor immune function as well, which is highly relevant and certainly has been over the last 12 months, is looking at our immune system and the role that the gut plays in our immune system and function. We are ultimately, or actually, no, I'll go back a step. Our digestive system is home to about 70 to 80% of our immune system. So that's huge, right? Like 70 to 80% of our immune capacity lies within our digestive system. And part of that is due to the physical barrier of defense, which is provided by the gut. Part of it's also due to the fact that we have these bacteria that live within our gut microbiome, and they have a flow-on effect to our digestive system and capacity. And then we've actually got cells of the immune system that live within our gut lining. So there's a lot of responsibility that our gut has for protecting us against invading pathogens, and also actually creating that, or feeding the army, like creating that line, that army, which is our immune system. So lots to think about when it comes to the digestive system. And I'm going to talk you through like a 101 of what the digestive system looks like, because I don't know about you, I'm a visual person, and I can appreciate that if you didn't do biology, or if you haven't looked at your biology books since year 10 or whenever it may have been, you may actually not have a huge visual of what the digestive system looks like. So essentially the digestive system is one long tube that runs from our mouth down to our bottom. And there's lots of different things that happen along that journey. But remember, the inside of that tube is the outside world. On the other side of that tube is the inside world, so our tissues. Digestion begins before we even eat. So when we look at food, when we smell food, we start to secrete saliva. And within that, there's some digestive enzymes. So you guys would have all experienced that, right? Like you can smell muffins baking in the oven. They're probably gluten-free, sugar-free muffins. Or you can, you're like looking at a lemon and your mouth starts to salivate. Or I don't know, you're looking at someone else's meal. So you start to secrete these enzymes and saliva, and that's digestion starting to happen right there. Then you eat your food, so you chew it, right? Like you chew it with your teeth, and the teeth are like almost part of that digestive process. They help to break down food to increase surface area of those food bits, so that when they reach the stomach, there's greater surface area for our stomach acid and enzymes to go to work on. So once you've chewed your food, it goes down your esophagus, which is like the pipe between the mouth and the stomach. And that should usually take about 30 minutes between the mouth to the stomach. Then the food hits the stomach. The stomach is an incredibly acidic place. It's the most acidic part of our body. It's like equivalent to battery acid in terms of its level of acidity. And this is why I said before that reflux is not a symptom of excess stomach acid. It's misplaced stomach acid. So our stomach is built to deal with that level of acidity. Our esophagus, however, is not. So when acid makes its way from the stomach to the esophagus, that's when those signs and symptoms of reflux start to appear. And so some people think, well, why isn't it always the pain just here? Why do I get nausea? It's not just localized pain because the nerves aren't that sophisticated in that area. So the stomach food goes to the stomach. It then starts to make its way through the stomach to the small intestine. And that process is anywhere between like 3 to 4 hours. And then the small intestine is this massive long tube, long skinny tube. And within that, there's these villi and microvilli, which are like hungry to pick up nutrients from the food that's passing through the tube. So this is where most of nutrients are absorbed within the digestive system. Hence why you aren't what you eat, you are what you digest and absorb. So you've got to break down the food, and then absorb the nutrients within that food. Once food's passed through the small intestine, it'll then feed into the large intestine. And this is not really a place for nutrient absorption. This is where a little bit of water is absorbed, but basically this is the waste matter. This is where the waste accumulates and it gets ready to be excreted from the body. Now, our large intestine is also where the bulk of our gut microbiome lives. So you've probably heard this term gut microbiome. I've already talked about it in this session, but the gut microbiome is where we now have so much emerging research on. So it's essentially home to, if you need to think about it, like 3 kilograms of bacteria. That's a ton of bacteria. We are like 90% bacterial cells, by the way, so don't be surprised if there's like 3 kilos of bacteria living in your gut. And if you are thinking, oh, I wonder if I got rid of that bacteria, if I'd lose weight. I have had that question asked before, but that's not 3 kilos of weight that you want to lose. Like you want to lose the body fat if you've got a weight loss goal. Those 3 kilos of bacteria, we want them in the right balance. So there's different analogies that float around. I use different analogies all the time, but I'll use the analogy of a rainforest right now. So we want a rainforest there in our gut microbiome. What we don't want is like a pine plantation. So we want diversity, right? Like we want the low growing flora, we want the high growing trees, and we want everything in between, because they all do a different job, right? Like different animals might feed on different plants and live within different plants. And Some plants catch the rain and some don't, and so on and so forth. There's lots of different jobs that are happening as a result of that whole ecosystem that is the rainforest. And that's what we want in our gut. So we don't want a lack of diversity, which is something we can test for now. We want depth and breadth. And it's actually called the Shannon Index. So the Shannon Index is how we measure the diversity of our gut microbiome. We want depth and breadth. We don't want all our eggs in the one basket. We want bacteria that produce short chain fatty acids and different types of short chain fatty acids, bacteria that help us to break down protein, that help us to create nutrients. And so that's why we want this depth of breadth of bacteria living within our gut. So we want to nurture that and support it. And it's not necessarily as easy as taking a probiotic, and hence why I want to have this chat about, like, what are your next steps? What do you do to maximize all of the roles of the digestive system? So my first recommendation and first step in supporting digestive health is one that might seem like an absolute no-brainer, but it's actually one that for a lot of people alleviates their symptoms. So like I said, I can get really excited as a nutritionist, and I can want to put people on probiotics and various supplements and healing protocols. But sometimes I can get results for my clients just by talking to them about their eating behaviors. And what I mean by that is looking at the mood they're in when they eat. So that stomach acid, those digestive enzymes that are helping us to break down food, the release of those will be deprioritized when we're in like fight or flight mode. Some of you may have heard me talking about fight or flight in our seminar 2 weeks ago. You could also refer to it as the sympathetic nervous system. But essentially in this day and age, we are really predisposed to chronically being in this fight or flight state. Yeah, like a growing inbox, traffic on the roads, kids with issues at school, bills need to be paid, lockdowns to deal with, like we can really be in fight or flight state quite perpetually. And that's not good for digestion, because then we start to lose the agents that help us to break down food. And then we can become really susceptible to constipation or loose bowel motions or reflux or bloating, or a combination of all of those things. Chewing your food's also really important. So actually allowing some of the enzymes in the mouth to do their job, taking some pressure off the stomach, and also helping to create that extra surface area. Again, taking pressure off the stomach. So chew your food really well. I don't think this is something I was taught to do as a kid. My mum grew up at a boarding school, and she said that at boarding school, you just ate as quickly as possible so you could go and get seconds. And I feel like that's the sort of, I don't know, that's her legacy that she left for us. So I still constantly work on the pace in which I eat. I try and get my chews up to 20 chews per mouthful. It doesn't always get there, but I'd encourage you to check it out for yourself. Like when you have your next meal, if it's one that you need to chew, see how many times you're chewing it, because I reckon a lot of us are getting through the day with like 4 chews per mouthful and then down the hatch, and then we're wondering why, like we feel sluggish or like food's not being digested properly. One mechanism or one thing that you can do to help you slow down and chew your food more is to put your knife and fork down between eating. Another thing that you can do is to actually like stop before you eat. So in many cultures, I don't know how traditional it is in like a I don't know, the culture that I grew up in many cultures, they will stop and say grace before they eat. So they'll stop and they'll say thank you, and they'll talk about what they're grateful for that day. And it's actually like inadvertently a way of encouraging the individual or the people at that table to stop, to breathe deeply, and to be present for their meal. And that is not what the vast majority of us do now. So we're like diving into our meals, we're trying to do it quickly, maybe we're having heated discussions, maybe we're doing emails, or maybe we're just trying to quickly do it between meetings. But it's the opposite of allowing time to stop, to get into rest and digest, to chew the food, enjoy the food, appreciate the food. It's very different. So one of the things you could do is start to introduce like a little bit of a, I don't know, a modified grace, maybe a spiritual rather than a religious grace before you eat, or just, you know, taking a few deep breaths before you eat. Ideally, you'd also allow 4 to 5 hours between eating your main meals. So remember I said that it can take like 3 to 4 hours for the stomach to empty and like half an hour or so for food to go from the mouth to the stomach. So ideally, you'd allow adequate time for that to happen before you eat again. That emptying is really important for this what's called this migrating motor complex, which is like this wave of contraction that goes through the digestive tract and helps to move things through. So if you're eating constantly, it actually can start to really impact the efficiency of the digestive system and the way in which you move things through. Now, in order to get that 4 to 5 hours between your main meals without going a little crazy or without getting antsy or hangry or actually hungry, what you need to do is take care of my step 2 for optimal digestive health, which is to focus on eating real food. So not last week, 2 weeks ago, you would have heard about my acronym JERF, which stands for Just Eat Real Food. It's important for metabolic health. It's as important for digestive health. So when it comes to real food, essentially you're looking to build a meal that is centered around 2 cups of non-starchy vegetables. So it's basically any vegetable aside from potato, sweet potato, beetroot, and parsnip. You want depth and breadth in the vegetables that you're consuming to support depth and breadth in the bacteria that live within your gut microbiome. You then want your portion of protein, not excessive, not underdoing it because you need that appetite control, but you want your portion of protein. So that might be a fist-sized piece of chicken, fish, red meat, tofu or tempeh, or it could be 3 to 4 eggs, or it could be a protein powder, or it could be a combination of legumes and seeds. That could be your portion of protein, but you don't want to overdo it. You can actually start to negatively impact the balance within the gut microbiome through excess protein. And then on your plate, you're looking for your quality fats, your fats with the anti-inflammatory properties, things like avocado, olive oil, avocado oil, flaxseed oil, other nuts and seeds, so sesame seeds, pumpkin seeds, hemp seeds, flax seeds. They're butters and pastes, so tahini paste, almond butter, and even coconut products. But these fats are what's going to help build the satiety and the appetite control so that you're not looking to fill your stomach up within 2 hours of having eaten your previous meal, and that rather you can allow those 4 to 5 hours for your stomach to empty and for things to be passed on through the GIT before you start loading it up again. There are also some other principles of eating real food which definitely play into digestive health. And some of you may have remembered me mentioning this idea of taking an anti-inflammatory approach to the diet. Inflammation or chronic inflammation being a huge precursor to some of our age and lifestyle related conditions, things like type 2 diabetes, Alzheimer's, cardiovascular disease, autoimmune conditions. And as a nutritionist, my job is to make sure that your diet and your gut is not excessively contributing to inflammation within the body. So some of the key culprits from a digestive standpoint are gluten. So gluten is a wheat protein found in wheat, rye, barley, couscous, semolina, and some of those surprise people. So some people tend to think like couscous is gluten-free, or farro is another one that people tend to think is gluten-free but is not. Now, gluten, obviously, for a subset of the population, is a trigger for an autoimmune condition called celiac disease, but that's only a small portion of the population. For the rest of the population, gluten is a relevant part of this conversation because it contributes to this state of increased intestinal permeability. So you remember me saying just before this term leaky gut or increased intestinal permeability. So you can think of our gut lining as being like a fly screen, and I like to use my hands to demonstrate this, but our gut lining is like a fly screen that has very fine pores and particles within it to allow nutrients and broken down proteins to get from our gut into our bloodstream. If that fly screen becomes compromised, those tight junctions become loose, then suddenly things that wouldn't usually be able to get through. So in the case of a fly screen, it might be the spider or the flies or, I don't know, the snake. You don't want that stuff to come through. It would initiate a response from the inside, wouldn't it? So someone would be screaming or running around the house with a fly swatter or a shoe or something. Our immune system does that. So when unexpected things, so bacteria, pathogens, undigested proteins, make their way from the gut to the bloodstream, our immune system initiates an immune response. We want to avoid that. And the precursor to that is gluten, because gluten can impact those tight gap junctions and cause them to become loose gap junctions. Stress can also be a contributor to that as well. Depending on the state of the gut, the gluten may be more influential in some people rather than others. I also really recommend a low sugar diet when thinking about digestive health. And that's because excessive sugars, and in fact, most sugars, are number one, going to take away room on the plate for other more nutrient dense food, more prebiotic rich foods, which feed our gut microbiome. And then number two, sugars could inadvertently feed the bacteria that we don't want to thrive, or they could feed other things like fungus that we don't want to thrive. So eliminating certainly processed sugars, and then considering how much in the way of carbohydrate, especially processed carbohydrates, is being added to your diet is actually a really important decision for the state of your gut and your digestive health. Nobody feels good when they've got bacterial imbalance or fungal overgrowth, and most parasites will leave people feeling pretty hideous as well, and excess sugar can contribute to all of those things. The third step and recommendation when it comes to supporting digestive health is to manage stress and toxin overload. So the question that often gets posed is, well, if I've got this gut microbiome, why isn't it self-managed? Like, why aren't I born with the microbiome, and why doesn't it just evolve in the way that it should? And that's because of our lifestyles and things that can get in the way there. So number one being the medications that we're exposed to. Pharmaceuticals in general can contribute to like a die-off of beneficial bacteria, but more specifically, antibiotics and the oral contraceptive pill or hormone replacement in general can contribute to die-off of healthful, beneficial bacteria in the gut microbiome. So often, you know, my questions to my clients when I first meet them will be about, okay, well, what's your history of antibiotic use? And, you know, are you currently on any form of hormone replacement? Because that will impact the microbiome. Not to say that you need to stop those things immediately, because sometimes there is a legitimate medical reason for needing those things, but awareness is key. So understanding that, okay, that could be setting your microbiome back a little bit. So what can you do elsewhere to like bridge the gap or make up for that? So you can reduce your toxins from other places, toxin exposure from other places, I should say, by looking at like the chemicals that you bring into your household or the products that you put onto your skin. And there is an amazing website called Nourished Life, nourishedlife.com, where they sell pretty much everything toxin free, from skin, face, skin, household products. It's a really great platform to get low tox products. And then the other thing is stress. So I said before that stress can contribute to increased intestinal permeability, but stress and excess cortisol in itself will act like toxin overload that will impact the gut microbiome negatively. And I know you're having like side discussions around stress and mindset and things like that as part of this, which I think is awesome for many, many reasons. Step number 4 is to really nurture diversity and to create the rainforest. And this is where people can go wrong, because they treat step number 4 like step number 1. And what I mean by this is that, of course, a probiotic supplement may help with creating the rainforest, okay? So science and modern technology, the same thing, I guess, they can package up specific strains of bacteria, put them in a capsule or a powder, and we can consume that probiotic supplement, which can have a positive flow-on effect to the gut microbiome. But it's not the only thing that we can do to create a nice and diverse rainforest. In fact, if it's the first thing we do, it can negatively impact the gut microbiome. Because who's to say that the one strain that you purchased in that probiotic is actually the strain that your gut microbiome needs? Who's to say that that strain that you're purchasing might actually be something that you already have an overgrowth of? And so you're actually perpetuating dysbiosis or lack of diversity in the gut microbiome. Remembering that most of the probiotics we buy are just like a tip of the iceberg in terms of the actual bacteria that are living in our gut microbiome. So we might see something like Lactobacillus rhamnosus very commonly in a probiotic capsule, which would make you think like, oh, our gut microbiome must be made up of Lactobacillus rhamnosus, like 50% of it. And that's absolutely not the case. You can get very specific with the probiotics that you choose, and there are some conditions in clinic where I would know exactly what strain of probiotic to use based on symptom picture alone. But then there are other cases where we actually need to do testing. And we can use a test now called Metabiome, which gives us a very clear picture of what bacteria live in your microbiome, in what sort of ratios, and therefore what probiotic strains would actually be helpful for you as an individual and your gut microbiome. So don't necessarily be tempted to go out and to start spending money on potentially expensive probiotics unless you've started to tackle steps 1 to 3, or you've spoken with a health professional who can help you narrow down your requirements to a specific probiotic strain. Because remember that ad, like oils ain't oils? I don't know how many people remember that ad, but probiotics aren't probiotics. So it's not like you walk into the chemist and say, I want a probiotic, and the person on the other side of the counter gives you a bottle. It is more complex than that. You can include probiotic foods in your diet, however, and that's a good thing because you're getting smaller doses of variety of bacteria or probiotics through probiotic foods. So that's things like apple cider vinegar, kimchi, sauerkraut. Perhaps it is a good quality kombucha, although I wouldn't overdo the kombucha. Perhaps it's another homemade probiotic product like a probiotic yogurt or a probiotic kefir, for example. Miso is also a fermented food, which is pretty yummy and pretty easy to build in. And I've missed something. Tempeh. Tempeh is another probiotic food which can easily be brought into the diet as well. It's a fermented soy product. And prebiotics. So prebiotics, again, you can buy a supplemental form of prebiotic, but I don't usually recommend it as a first step. Number one, because prebiotics are all around us in our diet if we choose to eat the right foods. And so you could potentially be spending money on a supplement when you just don't need to be. So prebiotics are found in things like garlics, onions, artichoke, asparagus, legumes and lentils, berries, green leafy vegetables, nuts and seeds. So they're just like, there's so much potential. Most plant matter will have some prebiotic capacity. And prebiotic is essentially just that which feeds the bacteria in our gut microbiome, so allows them to thrive and allows that diversity to take place. So they're the 4 steps to consider. Number 1 is eating behaviors. Number 2 is eating real food and avoiding some like key culprits like processed sugars, processed carbs, gluten. Number 3 is to manage stress and toxin overload / exposure. And then number 4 is to support that diversity and create the rainforest. Now, I said sort of ideally you wouldn't progress to step 4 until you tried steps 1 to 3. And if you're sort of wanting to know whether to progress to step 4, there is some really handy testing that you can get done. Or in general, testing is helpful because, as you heard me identify right at the start of this session, there are many things that can be signs of less than ideal digestive health, which means there's many possible root causes for less than ideal digestive health. So we can test for things like reflux, like pathogens in the stomach, like pathogens and bacteria in the large intestine, overgrowths in the small intestine, bacterial imbalances, fungal overgrowths. digestive insufficiency. Like there are lots of things that we can test for. And when we test, it does help to narrow down the treatment protocol and I guess reduce the time in which you're spent trying to figure out your digestive issues, and reduce the time in which you're treating your digestive issues as well. So if you're interested, blood testing is something that you can do. So tests that you can get done through your GP. And if you haven't checked on certain nutrients in the last couple of years, then I definitely would, especially if you're like bloating, inconsistent bowel motions, low energy, low mood, brain fog. I would be asking your doctor to look at your iron studies, your B12 levels, and also your homocysteine levels, to see if there is any signs of inflammation, which could be coming from the gut. Now, I did write an article or post an article at the Natural Nutritionist just a couple of weeks ago on blood test. What did I call it? You and your blood testing or something along those lines. If you go to our blog and look in the month of January, you'll see it. But there I've given a list of the blood tests, and in there is iron studies, B12 and homocysteine. So if you need to see it written down, you can see it there at that blog article. SIBO breath testing is something I do commonly in clinic. So that's an at-home breath test that allows us to see if there's bacterial imbalance in the small intestine. There are various stool tests that we can do. So depending on the symptoms experienced by the individual, there's a stool test called GIT MAP, which allows great insight to digestive capacity and function, and some insights to the gut microbiome. There is another stool test, which is like gives us this really clear picture of what's going on in the gut microbiome, and that's called metabiome. So worth speaking to a practitioner to understand which one of those is best for you. And then there's simple stool tests that you can get done through your doctor, which will allow the capacity to rule out certain parasites, allow the capacity to measure for blood in the stool, which we call fecal occult blood, which is obviously not ideal. And also allows us to test for fecal calprotectin. Now, calprotectin is an inflammatory marker, which is essentially like a marker for irritable bowel disease. So I usually recommend that those tests are actually carried out before we start digging into the microbiome. In some people they come and see me and they've already been screened for IBD and celiac and bowel cancer, and they're wanting to go next step, which is the microbiome. But it is really important that we rule those things out either concurrently or before we start to work more deeply into the gut microbiome. We don't want to miss out on some of those, I won't say more sinister, but some of those potentially treatable and life-threatening conditions that won't necessarily be treated through managing the gut microbiome. So in summary, I hope that you are feeling, I guess, a little more knowledgeable around what are the markers of digestive health? Like, what are we even sort of benchmarking ourselves against? What are the signs of less than ideal digestive health? And like, how many of those apply to you? You know, were half of those things ticked, or were there just one or two of those things? And that might help you to determine how quickly you need to start to get on top of your digestive health. And then hopefully you've also got some really practical tips that you can go away and start putting into place, whether it's just like solidifying what was it, razor edge habit, or have I got it wrong?
No, you're right, Elly, razor edge habits.
Good. Whether it's like, I guess, helping to solidify one of the razor edge habits you've already got in place, or reminding you that you did have one in place 6 months ago and you've let it drop, or if it's something new that you need to bring into your practice, your protocol. If testing something that you think you're ready for, like if you've just been tackling your gut for long enough on your own, then you're welcome to book in for a complimentary 15-minute consultation via our website. And that way you can just speak with myself or my colleague Steph and figure out, all right, do I need to do testing, or would I actually be better tackling steps 1 to 3? So consider that as well. I'm happy to open it up to questions as well, by the way. So feel free to tap away, or I don't know, unmute yourself and ask the question if you want to. I'll do my best to answer it. There's always one that's got to start it.
So everyone, feel free to throw it in the chat if you wish, or if you want to unmute yourself, you're more than welcome to. Maybe while everyone's thinking and starting off, Elly, I might ask you how old your dog is. I've just seen your dog over your...
Oh, can you see her there? She's whining a little bit.
Yeah.
She'd be 11 weeks. She was born on the 7th of December. What does that make her? About 11 weeks.
I've just seen her scampering around out the back.
Yeah, now she's whining. My partner's out surfing, so she's got no love or attention right now. I can't wait until she's 12 weeks because I can't walk her at the moment and she's full of beans. Hence the whining, because I just can't exercise her enough right now and she's a Kelpie.
Elly, I've got a question.
Yeah, sorry. Wendy?
Oh, no. One of the... Sorry, it's Claire.
Claire, yeah.
One of the things that I find really difficult to know is just in terms of your energy, I never know how much energy I'm lacking just because I'm getting older and how much energy, you know, I would expect to have. And so have you got any tips on sort of how to know whether you're doing about as well as you can do for your age, or whether you can always do better?
Yeah.
How do we monitor that?
I would say check some boxes, right? Like if you're getting 8 hours of sleep per night, if you have checked nutrient status, iron, B12, vitamin D, if you're eating 3 really good quality meals per day, and you're doing all of those things, but you're still waking up fatigued or have inconsistent energy levels, then maybe it's a sign that your energy is age related.
Mm-hmm.
But I would still say that there's a lot to work with. Age shouldn't necessarily be a massive hindrance.
Yeah, it's a tricky one, isn't it? But I agree with you. I think you're right. And I just myself flick backwards and forwards with that myself.
Also incremental as well. If your energy currently is polar opposite to what it was 3 months ago, then I wouldn't say that's age related. But if it's maybe incrementally got a little less and you've had to adjust your lifestyle to accommodate to that, then maybe that is more age related. Check the boxes though, go and get your iron and your vitamin D and things like that tested. Do you resonate with any of those signs of poor digestive health, and therefore could you need some work there? Are you sleeping your 8 hours a night, and are you building your meals in the way that sort of you've been learning about through the challenge, or the way that we discussed in our seminar 2 weeks ago? I'd check those boxes first, and process of elimination.
Terrific. Thank you.
That's all right. Thanks for asking.
Anyone else got any burning questions they'd like to throw out? Please feel free to.
No question is a silly question.
Lovely.
All right. If anyone throws anything your way after watching this, then feel free to let me know and I can craft an answer for you to share with the gang. If anyone thinks of anything afterwards, you can either send me a DM on Instagram, nutritionally is my handle, or find us or reach out at thenaturalnutritionist.com.au.
Right. All right. Well, Elly, on behalf of all of us, I'd like to say a big thank you to you for sharing that knowledge with us tonight. Hopefully everyone's got a couple of little things that they can... we've got a few people coming through later. Hopefully everyone's walked away with a couple of notes that they can implement into their own daily routine. But that was fantastic. So thank you very much for sharing.
Thanks.
Again.
Well, thanks for connecting us.
Yeah.
Much appreciated.
And for everyone else ongoing, we will be doing this, ideally this working relationship with Elly and the Natural Nutritionist. So you'll hear more from them coming later in the year as well, I'm sure.
Yeah, awesome.
Great.
Thanks, Mark. Have a great night, everyone.
Thanks, Elly. Thank you very much. Thank you, everyone, for joining as well.
Thank you.
Thank you.
Bye.
Good night.
Good night.